Hi everyone, welcome to this episode of Diverse Talk Matters. To talk about different things around diversity, equity, inclusion, talk about things that people may find challenges with, so we hope you find them really useful. Some are around people's different lived experiences, some really challenging conversation, things that sometimes we don't need to talk about. But we really hope you enjoy the range of topics that we are introducing to you or bringing to you, to your homes, to your house, to your workplaces. We hope you enjoy. So you both will be whenever a couple of these stats I'm going to share, and also it has been in the last couple of years in the media and the news, we've been aware that there's higher mortality rates for Black women in the UK. 4 likely more time to die during pregnancy or in postpartum period. There's meant to be maternity outcomes, much more disparities for Black and racialised women. And also, sadly, the evidence around quality of care is, that Black women might receive low quality care in some cases. And also, in terms of pain relief, there might be different pain relief. Now, we're not here to be negative about health service. We're lucky to have it. Don't get me wrong. It's great that we've got that. But there are those inequalities we can't hide from, and they're there. So knowing all of this, so what is your, what do you think, what's your thoughts around the historical mistreatment of Black women in healthcare? I'll go to Aiesha first, if that's okay.
But it's not new. I think if I think about like my medical school time and training, like we kind of did discuss things like health inequalities, but I think I didn't really understand it or grasp the impact of it, and it wasn't really taught in a way that was personal to me initially. I think the reality hit me really when I started working, and you start listening to people and hearing their stories and speaking to people from your community. But it is, it's nothing new. It goes back to colonialism and all the stuff, from then. So you think about kind of the way that, if you think about Black people specifically, like how they were treated during slavery, that they were commodities. A lot of the interventions and progress in things like gynecology and childbirth were through the exploitation of Black women. Lots of things done to them without pain relief, without their consent. And unfortunately, because that stuff has been embedded, it's kind of carried on. Again, if you just think about our history within the UK in terms of just racism, and even within the US, that's why and how some of those things have still been allowed to carry on and become ingrained in our thinking, because you have to remember that actually, healthcare is a function of society, right? And so as much as we can say it's not that the NHS, that healthcare or that doctors are racist, it's that we live in a system, and unfortunately a world, frighteningly at the moment, that was not initially set up in our favour to benefit our well-being, and so that some of that has been ingrained into policy and decisions making, into assumptions that we make about patients from certain groups, and that is the problem, really. And I think the difficulty and the frustration comes in that people from the community have always been aware of that, and no one listened to us. And now it's more that actually, as there's a lot of awareness now, but actually, are we seeing the change? Are we seeing the progress? And progress is coming, but it's not coming fast enough. And when I say fast enough, it's not coming fast enough for when it's you, when you're the person that's been waiting XYZ, or it's your relative that's in the hospital, and it's not good enough at that point, is it? You want it sorted, you want it fixed, you want it done now.
Okay, thank you. What about yourself, Lorna? What are your thoughts?
I think Aiesha summed that up really well. Yeah, I agree. The NHS is a huge system, and we must never forget that. And first of all, things can never be perfect in big, huge systems like this, but it is about systemic racism. And yes, we can put little kind of sticking plasters. We can have some great work being done, like all over the country, around about Black maternal health and improving outcomes. And we welcome that, because actually we are seeing small changes, and we are seeing that awareness raising, and that's really important. But until we address and make huge changes in this systemic racism that people are facing in the system, then, we are not going to see the kind of changes that we need to see. Those disparities that, gone, that the gap closing between those who are having, you know, a much better time and a much better experience of the system and those who aren't. We need to see those gaps close, and quickly, because you must remember that these stats are appalling. But behind the stats are people's lives, you know, families being like, you know, kind of, well, devastated with things like infant death, maternal death, or damage. So things need to, I wish that things would move quicker, but we really need to kind of, you know, really grasp a hold of. We're a part of society. The NHS is just a part of society, and we need to address those societal issues that mean that we are on the rough end of a lot of systems and education and housing and all that stuff.
Yeah. And in terms of, you know, because some people are listening might go, what do you mean the system? What do you mean? Because we know as Black women, we understand the system is not made for us at the top of that system. But what sort of things have you seen? I'll go with you first, Aiesha, within the care of women, Black women all going through the process of maternity, sort of those challenges.
So actually, from a clinical experience, actually, I've not come across many Black patients in obstetrics. So I did an obstetric job, and the community was very diverse, but it was more that kind of Asian population. But the assumptions are kind of the same, and I think that's the key thing. It's assumptions. Assumptions that we make either subconsciously or consciously based on patient populations, based on religion, based on whether the patient can speak English well or not, based on their educational level. Sometimes assumptions about educational level based on whether they can speak English or not. And I think those are the things. I think for the most of my interaction with kind of, I guess, Black specifically is within my role in pediatrics. And yeah, I think similarly, so I mean, breastfeeding is a classic one where there's some, unfortunately, even within the community, a lot of unhelpful myths and misconceptions around breastfeeding, you know, where people think they can't breastfeed because their boobs are too big, or, you know, to try this, try that. Some of the like cultural practices. So if you're West African, for example, where, you know, people think, oh, okay, let's go back to breastfeeding, because that's another good example where I had a parent who was being admitted to hospital, I think, because she had a wound infection from her C-section, and she wanted to breastfeed, and they'd called a family friend, I think, who was still breastfeeding their child, to come in and breastfeed the baby. And people were like going, what? Like, this is what, you know, and is this allowed? Like, she's not allowed. It's not. And I was like, no, that's perfectly acceptable if it's a trusted person that the, you know, parents know and she's willing to do it, and that's better for the baby if mum is really wanting to breastfeed and they're comfortable with that. And I was like, I mean, in developing countries they do that all the time. In this country, in the Victorian ages, that's what, you know, that was normal. It's perfectly acceptable and fine. And so I guess that's, yeah, I think just that is what I mean. I think those little assumptions, I think, and it permeates everything from pain relief to feeding practices to how people hold their baby, how people carry their babies. Yeah, I think that's just one small example, but yeah, I could tell you thousands of little ones, but it's all the same. So again, if you think about your South Asian women and about, you know, oh, they're very noisy. You kind of hear that a lot, don't you? You know, they make a lot of noise in labour, and that kind of thing. And anecdotally, you can kind of go, oh yeah, okay, yes, and that's fine. But actually, when you've got that individual patient in front of you, you need to you kind of need to put that to one side and take them, because that's the whole point of being a healthcare professional and being in care. And it's sometimes very easy when it's busy, I think, to become cynical and lose a little element of that.
I don't know if I asked this before, but when you trained and you were doing your medical training, did they do much awareness education around things like cultural competence, understanding?
So we had kind of that, you know, that social determinants of health, and in terms of you know, poverty and all that stuff and how that plays in, but not, and elements of it, if I was, you know, not going to be real, to be overly critical, but not in a way that was real to me. So again, there were very few people of color on my degree. And so anything like that and it was definitely not done in a way that felt real or personal or relevant to me as a person of color. let alone potentially the rest of the people in the room.
Because if people aren't educated, I mean, we're not here for one person they've supported to talk for that whole culture, we know that. But I mean, if they're actually not taught anything or educated about anything that's different to the norm, the white norm, for example, you know, this is why these challenges happen. And Lorna, what are your thoughts in terms of either the system or barriers that you've come across, maybe people you've supported or your own experience?
Yeah, those assumptions that we come up against they're maddening and they can be dangerous, you know. I see a lot of assumptions being made, even about myself, as I go in to support somebody or a couple for labour. Are you mum? Now, I'm always assumed to be mum. Yes, I'm of the age to be a mum of a childbearing, couple or person. But there's always assumption because most of my clients were black and brown families, and I couldn't be the paid doula. First of all, the family couldn't be paying for a doula. And secondly, I couldn't be a paid doula. So again, the assumption was if I wasn't mum, I was a volunteer doula working to support asylum-seeking families. Okay, now there are doula projects in the city that do that. That's great, but it wasn't always assumed that I was the self-employed paid doula, and so there's that barrier. Even though I say I am the doula, there was a like, but you're the friend. No, I am their doula. But you're her friend. Gosh, this is getting a bit maddening. Anyway, so it's that. And then there's a whole thing about agency over our bodies. And I certainly faced that myself when I was pregnant with both of my two kids. I was a single parent back then, and the assumptions and the lack of agency I had of my own body. I mean, okay, I'm going to be very frank. I hope it's not going to offend anybody or trigger anybody, but when I first contacted my GP surgery to say that I'm pregnant with my son, my second baby, the receptionist says we don't offer terminations here.
My gosh.
Huge assumption. Processes happened to me. I was a naive, I guess by then about 24-year-old, didn't know that I could have agency of my own body. And that's another thing I want to come on to is our parents' experiences and how they have influenced us and our expectations of healthcare. But things happened. When I look back now, I kind of wish I could time travel back to that time and give a few people an absolute mouthful because it was assault. It was assault. So that's maddening. And things like that are still happening today. So we have over 400 black and mixed heritage moms in the group, and they share stuff sometimes. And I'm like, that shouldn't have happened. That shouldn't. But oftentimes we don't know that we have that control over our bodies and can say no. For example, so my mum was a nurse. My late mum was a nurse back in the 60s, 70s, and 80s. And when I had my first baby prematurely, again, one of those stats, of black mums having preterm labours and births, I remember her saying, Lorna, don't press the buzzer to get a nurse to come, to get a midwife or a nurse to come. Don't make a fuss. Okay. Now I know where that was. It wasn't that she wasn't caring. She was a very caring mom, but she's very much do it for yourself. Go and fetch for yourself. Go and do for you. Don't bother them. And it's that kind of don't speak up. Don't make a noise. Don't make a fuss. Keep safe is what she's saying. That really kind of filters down and really it kind of drives our own behaviours, I think. And that's an awful thing, not to expect care and not to make a fuss and not to ask.
And like you said, your parents would have been saying this to protect you because they knew that if you did cause a fuss or saying something, you might be seen as that angry black woman,
And not only that, not only but seen as the angry, aggressive black woman, but also then is the punitive measures that we are sometimes subjected to. And again, these things come up in the group, I'm scared to speak up because I'm still under their care. Yeah, I'm scared to raise a concern or make a formal complaint because I'm still under their care. Let me wait until I've gone home and been discharged. And by then, we're so submerged in parenthood and motherhood and all the stuff that goes with it that the complaint or the concern gets sidelined. So I actually do support people to give that feedback, make that formal complaint. I support them to do that because otherwise we just won't do it and people won't know and will certainly get away with behaviour that's not acceptable.
Yeah, because you're in a very vulnerable. position, aren't you, there? Because you want to be supported, but you want to be treated fairly, you don't want to be seen negatively. And I mean, even my experience, only later down the line when I hear things about these stories about black women, because you think your experience is normal, you think, oh yeah. And I was quite an older mum. And it's only now I think, oh my gosh, if I wasn't a vocal, assertive person, I would have had a different experience. Now I'm a professional, so I wasn't angry. I was like, no, I'm not doing that. I went in to have my son, now 13, and I went in and they were literally sending me home, sort of shrugging me off, sort of the attitude was like, what's she doing here? Tried to send me home. I was like, no, I'm not going anywhere. To cut a long story short, it was a good job because I had my child 3 hours later. So, but they were literally trying to dismiss me. What are you going here? You need to go home. There's no need for you to be here. And I had to say, no, I'm not. I'm staying here. Thank you, etc., etc. And I had to push back on a few things. I never remember. I was there probably an hour and a half even. And they came and they were like, oh my gosh, started like running me down, literally thinking what has happened. And my mum was with me, my partner at the time was with me. My mum was like, listen, if you're anything like me, you'd be having that baby quickly. And that's another thing in my mind. I was like, one, I wasn't going to be leaving anyway because I want to be near the hospital. But second, I thought, no, mums know what they're talking about. But a lot of things they were dismissive in. A lot of things, lost my notes, were like, oh, too many things to tell you. But, don't get me wrong, everything worked out. And the people who did the midwives who delivered my baby were absolutely lovely. But the whole process before, I thought, wow. And I just thought, oh, that's just me. And I sort of shrugged it off. And then you hear, well, actually, that is probably a lot of other people's experience. And I had my baby in a place where there were not people, where I live, there are not many people who are from racialised communities as well. So, so again, I thought, there's only those stereotypes here about, I don't need this or I don't need that, so it was very interesting. Like I said, it's only later on I thought, wow, this is a thing that happened to a lot of other women. So yeah, my experience was very interesting, to say the least. A bit like a comedy, you could tell the whole story.
It's really good that you were able to advocate for yourself in that at that time. And I teach parents about advocating for themselves, and I think it's important. It's a skill for life, not only for pregnancy and birth. It's a skill for life, right? Great. But the onus shouldn't be solely on us to have to keep piping up, because for some people, and I include myself in this, sometimes we get to the situation. I had it fairly recently. I went for a pelvic scan, a couple of years ago, and I got in the room and speaking to the person who was going to scan me, and there was a guy in the room stood there with his arms folded. So she's going through my notes on screen, and then she says, "Right, can you just go over to the couch, slip your trousers off and your pants off?" And I'm like, "But who's that? Who's he?" With his arms folded, eating popcorn. Who's he?
Gosh.
He wasn't eating popcorn, but you know what I mean. The observer. And she said, "That's your chaperone." I said, "Pardon?" I said, "Oh, I prefer a female chaperone if that's okay." And she turned around and said to me, "This is the NHS." Now, the thing is, she'd seen my records and I've had private gynae care prior to that. "This," she said, "is the NHS. And basically, you get what you're given. And if you don't agree to having him today, yes, you can turn him down, but you're going to have to go back through the whole process and get the referral done again." And this was a really important appointment. I was checking on a lump that they'd seen a cyst. Well, I wasn't sure what was a cyst, but it was a lump on my ovary. I can't now go away and wait again for a re-referral or for how many weeks till we get a female chaperone. So I'm like, okay, well, look, I will have it now, but he needs to stand at the head of the flipping, at my head, not at the business end, right? But I didn't feel that I advocated it for myself in a very strong way, how I would for a client, for example. So it can paralyze you sometimes,
100%. And you're in that position. So you're in that position, and anything around health, generally, it might be a nervous situation. You'll sit there and you probably prepare, and that's why some people say why I think doulas and support is so good, because you may have an idea in your head what you're going to say and what you're going to do, as all of you know more than me when it comes to childcare. But anything can change, So it was, you have to be, to have that support is really important, and to to be prepared is one thing, but you could be a really confident person in other life, in all worlds, and then something happens and it's all gone because you've got a whole million other things whirring through your brain completely. No, I get that. And again, like I say, if people can get support, or even, you know, if you could even, the person, you know, if you're going with, in terms of childbirth, you're going with someone's with you, give them the tools as well so that they can sort of speak up for you if you forget or whatever, you know, because your brain's all gone at that point anyway. Well, talking
I have
personally.
a question, if that's okay.
Yeah, go for it.
What do you like, Lorna? How would you describe, or how do you try and teach people about advocacy and communicating effectively without, I don't have to say this very diplomatically, without the, I guess, anger, frustration element?
Yeah, so I say we're going into it, we're not there. It's not about being confrontational. It's about putting your point across, or asking questions even, because the answers that we get will help us to make an informed decision. So, you know, I use the whole thing about the BRAINS acronym, you know, ask about the benefits and the risk and the alternatives, and using your intuition. And S for smile, I say. It can be S, you know, what's the science behind this? But I say S for smile because we're not angry, we're not arguing, we just want to communicate our wishes or ask you questions about our care. And so it doesn't have to be confrontation. And I also say S for space. I sometimes say, well, look, if it's not an emergency, put a bit of space in between you and the person. You know, even though if you ask them to leave the room for a few minutes to kind of gather yourself, breathe a bit, and then come back and have that conversation or ask those questions. You know, it doesn't need to be an angry exchange. You know, you're just there to, you know, you're entitled to put your point across, and you're entitled to ask questions, and you're entitled to get the kinds of answers that you, as a layperson or a parent to be, can understand. It's as simple as that. But it's
I
not
think,
simple.
yeah, I think that's something that I found quite difficult, especially now I've started working more in Birmingham. So there's a more skew to kind of your Black community versus sort of the South Asians, which I'm predominantly been. And obviously I work in A&E, so it is a high stress environment. You can kind of you can kind of almost pick out the people who've potentially had bad experiences before, or who are coming in with assumptions that they have to fight for what they want, for what they think their child needs. And it's, for me, really difficult to watch, one, and to interact with, because one, some of it I know will be out of fear and concern for their child that's unwell. Some of it is just because emotions are heightened. Some of it I think will be, again, because I know they've probably had a bad experience, or they've read all this stuff that we see in the news about poor outcomes and they're terrified. But I just find it really difficult to navigate, again, as a healthcare professional and someone of colour. Sometimes I'm actually acknowledge I'm not always the best person to deal with them. But yeah, I'd find it really difficult to try and navigate that situation from the healthcare professional side. Because what I wanted, you know, like I had a parent the other day, and they weren't combative, but they were just really like, you know, my child, you know, the classic, my child's on budget, which everyone complains their child's not missing quick enough in A&E. But actually and again, from an A&E perspective, I think people just don't realise how long stuff takes in healthcare sometimes. So actually they've been seen quite quickly. But, you know, he was standing up, you know, don't forget about my son, don't forget about my son. But it was really stressing the team out, like, because we had lots of sick patients. And yeah, I mean, in that situation, things escalated, and he started shouting at me. And so this was getting, and I just had to sit down, and I was like, come on, guys, like, this is, you know, this is not the way to get what you want. I get it. Your anxiety is up here, like your stress is up here. But like, look, I'm here with the stuff. I've been helping you. Like, I'm trying to help you. And I think that's the thing we spoke about last time as well, Tash, is like that. I don't know how to navigate it, because actually my experience of healthcare as a patient has always been really good. But I know that's not everyone's, and that is the reality. And I think it's really difficult to, you know, if you're in a family where, you know, you feel like you've been mistreated, and especially, and that's why it's so important in maternity and child services, because that is usually people's first real interaction with healthcare, unless they've had like an older relative that's unwell, or maybe they've been a child with an illness. For most people, you know, you go to your GP for a cough or a cold every now and then, but actually the birth of your first child usually is your first real full-on interaction with the health service, with the NHS, with hospital, and that can have a huge that poor experience can just have such a huge impact on, you know, your outlook and your perception of the service. I don't really have an answer for it, but it's just
And
a
I think it's
thought.
just for healthcare professionals to have an understanding of the challenge. We work with all different people or organisations, diverse matters, and sometimes we do this, you know, this exercise about lived experience, because people have got to understand. I'm not advocating for everybody being, you know, rude or out of order, but they've got to understand if somebody from a marginalised community, you know, may be speaking in a certain way that they felt, oh, sorry, they've got to understand the journey before. Obviously, they've got to behave themselves within the boundaries. Absolutely, zero approach to, you know, inappropriate behaviour. Got it. But someone have got to understand. They've not even thought about A to B to that person coming to that hospital right there, or that clinic, or that health facility. And I think this is why, you know, when I asked earlier about the whole cultural competency awareness, because to me that is a massive gap. You know, sometimes we do training and support and consultancy with health providers, and I am stunned about the fact that they haven't had that as part of their core learning, and at all levels. And not, it could be doctors, nurses, support workers, anybody in the health service, and it isn't there. And I think, you know, that's one thing, I think, minor thing I'm saying in the bigger picture of things. But what else do you think I'll come back to you, Lorna, then I'll go back to Aiesha. What do you think other things could be done to change, to address these inequalities, whether it's in childbirth, maternal health care, you know, pediatrics, like, you know, what do you think sort of things that do need to change?
I mean, we're seeing some good work done by the MNVP, gosh, Maternal and Neonatal Voices Partnership. So they're there on hand to kind of gather the parent voice and feed that into the system, as it were, and the system to feed stuff through to the parents. It's kind of like that kind of conduit, that kind of middle person in between. They're doing some great work in co-production of services. Certainly inviting parents to come in and feedback, or to feedback via online services, to come and assess. So we've got things like kind of, you know, walking through the units and assessing that. And I'd love to see I don't know if it happens already, but I'd love to see parents being involved on interview panels for either student midwives or student obstetricians. I think that would be a great idea if it doesn't happen already. But it's hard. As I said, this is a big system, and people, let's be really straight here. People who have racist ideas and behaviours. They don't change those behaviours or ideas when they put on their white coat and they put on their stethoscope, or they put on their, you know, their uniform. It's going to seep into their interactions with people, and it's going to inform and drive their practice. So how do we change that? How do we get people to see us as people? How do we get that heart-to-heart interaction? I always talk about heart-to-heart. See me for a person. See me for a person who's worthy of a good standard of care. How do we get that to happen? Because that's deeper than just having people on an interview panel, or, you know, courses. I mean, you know, courses are great, awareness raising is great, but how are we going to get that proper inner change and that big change? It's a challenge.
And I think for that, I mean, one of the things I would say, and I'm going to come to you, Aiesha, in a minute, is around, you know, in terms of, sadly, you are going to have people who might not have those inclusive values that we would appreciate, but what they need to make sure is their actions and behaviours are appropriate and good in the workplace, and if they're not, they're challenged and dealt with, and there are consequences. Now, I'm not sure that part of it is done. I would love a world where there was no racism, sexism, etc., etc., but where it does happen and it is acknowledged and it is seen, for me, it's about what's being done about it. And I don't always think that something's done about it. They should be making sure those people are managed and dealt with, and if they need to go, you know what I mean, and that type of thing. I think the whole process of managing those things aren't always dealt with the best ability, even though there's lots of brilliant health professionals out there, absolutely lots, don't get me wrong, but he's dealing with those ones that give the others a bad name, really. Aiesha, what about your thoughts in trying to sort of address or help this situation? Or
Yeah, I think it's a big one. I think going back to the system, sometimes it can feel a bit hopeless, if I'm honest, because you think actually it's an issue that's so big. But I think on an individual level, as a healthcare professional, I think it's just about really doing the work of understanding your own biases and your assumptions based on, where you're from, where you grew up. I think that was also for me personally, again, when I talk about, being a person of color, that was also something that was actually really hard for me to do. Where I actually had to take some time and sit back and say, actually, even as a person of color, I've got some thoughts and assumptions that I make about people that are wrong, that are biased, that are at some point sometimes racist, that I've had to really, and it was really, really painful to do. But I think really important. I think that's probably an important point to make as well, actually, is that it's across all levels. So, just because you are a person of color doesn't mean that you haven't grown up or inherited or picked up on some of those attitudes, thoughts and behaviors that are unhelpful. So I think that's the thing that's really going to make the changes for everyone to have done that work. And yeah, just to keep challenging each other. I think assumptions on any level. I mean, in medicine, you're not supposed to really assume, but we kind of pick out patterns and, but I think also, even with that, we're not supposed to assume, but actually within our brains are wired to kind of, pick out patterns and do that. And so that's okay. But it's recognizing that and recognizing maybe the thoughts and patterns that are unhelpful and being able to challenge yourself and challenge other people as well.
Yeah, definitely. Well, I've talked about some of the challenges. What about some success stories? Where have you got any success stories where you've had brilliant, had really good times where this support has been really excellent and it's been a good example or good practice? Lorna saying yes. Is that you?
Yes, thank you. I know these things, this is serious stuff here, and people are having a really rough time, but I always want to say, but there's also really, really great examples of fantastic gold standard care within the system and out of the system. And we mustn't forget those, because remember that you've got people who are pregnant and expecting a baby who are watching these things, and how that must play on the mind. Am I going to be the next stat? Am I going to come out of this whole and healthy, me and my baby? So we've got to say, actually, I've been very, very fortunate to witness a lot of really joyful, fantastic, and positive birth experiences. And largely, I mean, some of them have been out of the system, but there were those who've been in the system. I've worked alongside some fantastic, fantastic healthcare providers who have been very parent-centered, who have been very respectful in their interaction with the parents. I mean, it just makes such a difference. Whether you're birthing, people think, oh, it's all about, vaginal birth with no pain relief. No, we have all birth is birth, okay? And so, having a great C-section. I've been in theatre, and the team have been, chef's kiss, because we make a little C-section kind of birth plan, and they honor it to play the music and make sure that that skin to skin happens, and a little bit of delayed cord clamping and all that kind of stuff can happen, and they're just so respectful of the parents. So yes, I've seen lots of fantastic good practice that really supports the parents' needs. Yeah.
Lovely. What about yourself, Aiesha?
Yeah, that's same here. Definitely. Like I said, I'm working in Birmingham at the moment, and I think the teams that I've been worked with are excellent, working in really challenging environments. I mean, I think the other thing I think what you picked up from a birth point of view is birth is birth, and I think it is possible to go through really difficult labor and still come out and have a positive experience. And I do feel like some of the, not just within people of color, but also I think some of the problems we see around maternity is the unrealistic expectation and thoughts that people have around labor and what it's really like. Like it's not what you think. It's not what you
You
think.
can't
It's
explain
not,
it.
you can't explain it until you've done it, or unless you've been to lots of deliveries, like we have. But that one born every, or whatever it is that's on TV now, it's not even close. It is messy, it's painful. You don't really sometimes are aware of what's going on with your body. You go, for me, I went into labor and they said, oh, you're not ready yet. And next thing I knew, I had similar to you, I had my son in my arms. My body just kind of knew what to do, but I had no real awareness or understand, I kind of knew what was happening, but like, all of that. And that's why, like we talked about, kind of having people that advocate for you, that's that voice that you can fix your gaze on, and repeat things back to you, because there's so much going on. And
Yeah.
that kind of also feeds into it. So I think that's important. But yeah, so I've equally been to lots of deliveries kind of from a pediatric side, which have been really positive, preterm and term births. From a kind of baby and childcare perspective, again, as a pediatrician, like I've seen lots and lots of examples of excellent care across the region, not just in Birmingham, like across the West Midlands where I've worked. Like people, there are so many people that do really care, that get really angry about these kind of things, about inequality and injustice, and will call it out.
Yeah.
And there's lots
And
of
that's what's needed, the calling out.
Yeah.
That is the key part of it. Not letting it, you're not there colluding, or, you are there and you are speaking up. And that is, even if each person did that, that would make a big change. If more people spoke up, and that wherever they were, whether it was hospital, clinic, wherever, that there was support for those people who did speak up, because that's got to be right as well. You can speak up and then you're the person who could be vilified, so it's got to be safe space to do that. So in terms of sort of research, or, any of you, either of you, if you want to talk, what do you think would be really good in terms of any sort of research to be critical to really help, address the inequalities of Black women, whether in maternity,
So there's
paediatrics,
five times more are doing the Black maternity survey at the moment, aren't they? So I think if
say that again, sorry.
5 times more, the organisation.
Brilliant.
They've got their Black maternity survey that's live at the moment. I think if anyone's interested in contributing to that would probably be my first point of call.
Excellent.
And I think getting involved with like your local MNVPs as well.
What's MNVPs for us lay people?
That's what sorry, Lorna mentioned it earlier. So maternity neonatal voices partnership.
Right, cool.
They should be all set up within your locality. And the benefit of that is you're then speaking directly to your local hospital healthcare providers versus just kind of on a national scale. So then that it's a bit like, I guess, similar to writing to your local MP-ish in a way, in that the changes and the concerns that you raise are going to be specific to your area rather than just generic changes. I think there is a lot of research that is being done, and there's good stuff out there. I think, like I said at the beginning, it's just that are the changes that we want to see coming quickly enough.
Anything you want to add on that, Lorna, at all? Or?
Just very quickly, we're seeing research being done. We're seeing fantastic work around now, how we identify things like jaundice in darker skinned babies. Hooray! We've only been here how many years, but hey, at last, how we identify mastitis in darker skin. So it's coming. It's slow. It's like, why is it taking so long? But it's coming. So I'm hopeful.
Aiesha, anything you haven't got an opportunity to say you would like to say?
I think, just to summarize, I think what we said about just the importance of understanding the pathway that you're going to be on if you're having a baby. I think, again, from my point of view, my bugbear is, which is with the company and things I found, is around postnatal care. So after you've had a baby, that's it. You're left to it. Crack on. I think, that would be my thing, to really, if I was going to, anyone who's pregnant or who's thinking about having a baby, my one bit of advice to them would be not just to stress and worry about your maternity journey, really think about your postnatal support. Who, if you're living somewhere where maybe you don't have mum or a grandparent or whatever next to you, really spend that time investing in your support network, in your current friends who, other women who might be pregnant at the same time, whether they're the same culture or whatever, is not, because that is in some ways more important than having a really good pregnancy and labor journey, because that's a time limited thing. It's 9 months and hopefully a day or two of labor, and then you're done. But that postnatal period can have a huge impact on you as a family, and the development and well-being of your child.
Lovely, thank you. And one last thing for me will be, can you let us know if anyone wants to find any more about what you do? Is it all talk,
Yeah,
and then
so
where they can go?
Yeah, so on LinkedIn or my website, which I can send you a link to, but the company is called Awakened, so AWEKIND.
Lovely. Thank you. Lorna, anything you feel you want to say we have an opportunity to say yet?
Yeah, I want to drive home that postnatal message. Thank you, Aiesha, for that, because that is my big thing. So you can have the most wonderful of births, beautiful, roses around the garden, and then it can all then fall flat in the postnatal period. So definitely put some thought in. Do not wait until the baby arrives. Do it in pregnancy. Curate and create that village, I say, and pin people down. You may say Auntie Mary lives 2 doors away, it'll be fine, I'll be fine. Auntie Mary's off raving at the weekend, okay? All right, and she works full time and she hasn't got time for you. So get Auntie Mary, say, Auntie Mary, you know what? I know you're busy, but I love the oxtail that you cook. Can you do me a pot of oxtail so I can put it in the freezer? Because that will aid my postnatal recovery. So get your village together, find out about what's going on in your area before your baby comes. Because believe me, once that little bundle of fun is in your arm, you will not have the time or the energy to be jumping on Google looking for osteopaths and baby groups and feeding groups. Do it before baby comes.
Lovely. And also, anything could you let people know about how to find out more about you, get in touch?
Yeah, you can find me on LinkedIn. I think I'm like Lorna Phillip Birth Village or something like that. Again, I can send you the link. You can find me on Instagram, but I don't post often. And that's black_mamas_birth_village, or Instagram at Birmingham Doula.
Lovely. Thank you both so much. And we hope everybody listening, whether you are, a woman yourself, black woman yourself, had some experiences, or, you're somebody who may be going through it, or it's just good information, because sometimes, like I said, it's been great. There's been more awareness about it, but you can't beat from hearing it from professionals. So thank you both so much. I appreciate your time. Until next time, bye for now, and thanks everybody for listening. Thank you so much for tuning into the podcast. Please do spread the word about our channel and tune in for our next episode.